More than 29 million Americans live with diabetes every day, and for some, 6 million of them, insulin is a life or death medication. Between 2002 and 2013, the price of insulin more than tripled to more than $700 per patient. Federal lawsuit accuses the 3 insulin manufacturers of conspiring to raise their prices. The drug makers deny those allegations. Anna Werner shows us the impact of the price hikes on the patient. Anna, good morning.
Oh, good morning, Gayle. Those high prices combined with rising insurance deductibles mean many people who rely on insulin are feeling sticker shock. Even doctors say without a way to pay, some patients are left facing impossible choices.
I'm so sorry to see you again in the hospital.
This cell phone video shows Dr. Clarissa Levitan talking to her patient, Shauna Thompson, back in the hospital because she couldn't pay for her insulin.
One vial of insulin cost how much for you?
$178.
It was the 4th time in just over a year that Thompson had to be treated for a life-threatening diabetic coma.
Patients come in and say, I can't afford to take it, so I'm not.
Dr. Levitan says it's common for her now to hand out free drug company samples of insulin, just so patients can stay on their life-saving medication.
Patients are begging for samples because they can't afford the insulin.
Not asking, you're saying begging?
Begging.
Like 74-year-old Kathleen Washington, some months her insulin runs over $300 a month, more than she can afford.
I must pay my mortgage.
And so if it's a choice between the mortgage and the insulin?
It's going to be the mortgage.
Investment research firm SSR Health analyzed insulin list prices from 2012 to 2016 for the 3 companies that manufacture it and found prices went up between 99 and 120%.
Companies do it because they can. Right?
In a separate analysis, SSR's Richard Evans also found a striking pattern. The prices of 2' insulin drugs rose in lockstep, mirroring each other 12 times between 2008 and 2014.
The 2 companies took price increases within days of one another, and the price increases were similar, even identical, down to the percentage point.
If you raise your price and I raise my price to the same level, what am I saying to you as a company?
Let's keep going, or I'm not going to fight you.
Vermont Senator Bernie Sanders is calling for a federal investigation alleging collusion among the 3 drug companies, Eli Lilly, Novo Nordisk, and Sanofi.
Just coincidentally, it happens that the 3 major suppliers of insulin seem to be raising their prices at the same exact time, at the same level. So I think you have to be very naive not to believe that there is collusion.
The companies deny they've broken any laws. Sanofi told us there's strong competition on price. Eli Lilly said it's aggressively competing on net or negotiated price. And Novo Nordisk's president said on the company's website that increasing list prices is designed to offset rebates and price concessions to maintain profitability. And Lori Riley, with the trade group that represents U.S. pharmaceutical manufacturers, told us,
I don't believe there's been collusion by our companies.
She points out, although the drug companies' list prices are up, the negotiated prices for insulin, what the industry calls net prices, have gone up just 2 to 3% overall. She says that's because intermediaries called pharmacy benefit managers, or PBMs, negotiate for rebates from drug companies, take a fee, then pass those lower net prices on to insurance companies and ultimately consumers. The problem, says Evans, is patients who have high deductibles or little or no insurance don't get those discounted prices.
So in other words, the people who can least afford these increases are the ones who get hit by them.
Everybody gets hit by them a little bit, but people that can't afford it get hit disproportionately.
But Riley says,
when you look at the evidence, the competitive marketplace is working, and it's working very aggressively to help keep drug cost increases in check.
I'm listening to that statement, and I'm hearing consumers go, are you kidding me?
There is an issue for many patients who today face increasing deductibles. If those patients are coming to the pharmacy counter and they're paying full list price, while their insurance company or pharmacy benefit manager has bought that drug at a 50 or 60% discount, that is a problem.
The country's largest pharmacy benefit manager told us drug makers are the ones raising the prices, but experts tell us that there's plenty of blame to go around here in the system. Meanwhile, all three insulin manufacturers say they've announced new initiatives to make insulin more affordable for patients who need that help. You can go to cbsthismorning.com to find more information about those initiatives in detail, as well as an email address where you can contact us about this issue or any other consumer problems that you think we should look into. But it is a complicated
It's
picture.
just so murky. And as a patient, you just feel at the mercy of this system, which is just so hard to understand.
Well, lots of finger pointing all around.
And our show has been on the forefront of reporting about these rising drug costs. And let me tell you, when Obamacare ends and people have higher deductibles and are paying more out of their pockets, this is going to become an even more
Bigger
acute
issue.
problem.
These prices hit them because they'll pay the list price, not the lower negotiated
All right,
price.
Anna, thank you very much.